Have you ever sat in a doctor's office, waiting for answers, and wondered, what are they really thinking about me? Are they listening to every word, or are they quietly writing off some of your struggles as just part of getting old? Maybe you've noticed it yourself. You mention a new pain, or a troubling change in your body, and instead of digging deeper, the doctor shrugs and says, well, that's just age. And you leave the office with more questions than answers, and maybe even a little doubt in your heart. Here's the truth, doctors don't always say what's really on their minds when it comes to older patients. Some of those unspoken thoughts are harmless, but others? They can mean the difference between feeling seen, heard, and cared for, or feeling invisible. And that silence can affect not just your health, but your dignity, your independence, and even the way your own family treats you. And that's why this matters so much. Because when you understand how doctors actually view aging, not just the polite version they share with you, you can change the way you approach your health. You can ask better questions. You can stand your ground. You can protect yourself, and you can make sure your golden years are lived with respect, comfort, and confidence. So in today's video, we're pulling back the curtain. I'm going to share with you 5 ugly truths doctors rarely admit about older patients, truths that every senior deserves to know. And by the end of this video, you'll see exactly why these hidden realities matter, and how you can use them to take back control of your well-being. But before we dive in, let me ask you this: are you ready to have an honest conversation about aging? If you are, type "I'm here" in the comments below. And if you want more straight talk like this, make sure you hit that subscribe button to join our community here at Elderly Wisdom Tips. Because here, your years of wisdom aren't just respected, they're celebrated. Let's start with the very first ugly truth, and it's one that so many of you have probably faced at some point in your life. Imagine this: you walk into the doctor's office because you've been dealing with constant back pain. It's sharp, it's nagging, it's keeping you up at night. You explain it, expecting your doctor to show concern, to maybe order some tests or suggest a treatment. But instead, they give a little smile, maybe a nod, and say something like, "Well, that's just what happens when you get older." And just like that, the conversation ends. Now think about that for a moment. How would that make you feel? Brushed off? Dismissed? Almost as if your pain doesn't really matter anymore because of the number of candles on your last birthday cake? This happens far more often than people realize. Here's the truth: doctors are trained to see aging as a process, and yes, certain changes in the body are normal as we grow older. But here's where it gets dangerous: sometimes, what gets labeled as just aging is actually something far more serious. That back pain you mentioned? It could be arthritis. It could be a pinched nerve. In some cases, it could even be an early sign of something bigger. But if it's dismissed too quickly, you're left without answers, and without the help you truly need. Many families assume that when a doctor hears a complaint, they always dig deeper. But the reality is, many don't, unless you press them. Not because they don't care, but because they've been conditioned to see certain issues in seniors as inevitable. And that's where the danger lies. This is why you, as a patient, or as someone caring for a loved one, need to become an advocate. You need to speak up. Don't be afraid to ask direct follow-up questions. A simple line like, "Doctor, could there be another cause for this?" can completely change the conversation. Sometimes that one question is what makes a doctor pause, take a step back, and reconsider whether it really is just age, or something else worth checking. Because here's the hard truth: if you don't insist, nobody else will. And your pain, your symptoms, your concerns, they deserve to be taken seriously. Every single time. But being brushed off as just old age is only the beginning. There's another ugly truth that digs even deeper, and this one affects the very way doctors spend their time with you. And it can feel both frustrating and discouraging. Picture this: you've been sitting in the waiting room for nearly an hour. You've rehearsed in your head the questions you want to ask, the concerns you want to bring up, maybe even the story of how your health has been changing lately. Finally, your name is called, you sit down, the doctor walks in. And before you can even finish your first sentence, the clock is already ticking. In less than 10 minutes, you're being guided out the door with a prescription in hand, wondering if they even heard what you were really trying to say. And here's why this happens. In today's healthcare system, doctors are under enormous pressure to see as many patients as possible. Every minute counts, and often, the longer and more complex the case, the less time they feel they can give. Unfortunately, seniors, who usually have longer medical histories, more prescriptions, and multiple health concerns, are the ones who get the short end of the stick. Now, you might think that having lived a long life with a detailed medical history would make your doctor want to slow down and really pay attention. But strangely enough, it often works the opposite way. Instead of digging in, many doctors speed up. They assume that because there are so many issues, they can't possibly address them all in one visit. So they pick one or two, and move on. And that leaves a lot unsaid, and a lot unresolved. But here's the truth you need to hold on to: your time with your doctor is yours. It may feel like they're rushing you out, but you have every right to make those few minutes count. And the best way to do that is to come prepared. Write down your concerns before your appointment. Put your most important question at the very top of the list. That way, even if time runs short, the issue that matters most to you gets addressed. Something as simple as a piece of paper with 3 bullet points can completely change how the conversation goes. Because once the doctor sees you're organized and intentional, they're far more likely to slow down and actually listen. You don't have to feel guilty about wanting answers. You don't have to feel like you're wasting anyone's time. You've earned the right to be heard, fully and completely. But when conversations are cut short, something else happens. And it's even more personal. It's not just about time anymore, it's about who the doctor actually chooses to talk to. Ugly truth number 3 is one that stings in a way words can barely describe. Sometimes, doctors don't even talk to you, they talk around you. Picture this: you're sitting in the exam room, right there in the chair. The doctor walks in, looks at your son or daughter, and begins asking them about your health. They ask how you've been feeling. They ask if you've been taking your medicine. They discuss your habits, your symptoms, your concerns, as if you weren't even in the room. You sit there, listening to people talk about your body, your life, without ever turning to you directly. Now, why does this happen? It comes down to age bias. Some doctors assume that because you're older, you can't process the information on your own. They think they're making things easier, or they believe your family will remember details better than you will. But here's the hidden problem. It takes away your voice. It makes you feel invisible. And worst of all, it sends a message that your input doesn't matter. And while families often believe they're helping in that moment, what they don't always realize is that it can be deeply disempowering. Imagine sitting there, wanting to answer for yourself, but watching the conversation flow right over your head. It can chip away at your confidence and your sense of independence. But here's where you can take back control. You don't have to be silent in those moments. With kindness but with firmness, you can speak up and say something as simple as, "I'd like to answer that question myself." Those 8 words can change the entire tone of the room. They remind both the doctor and your family that your perspective comes first, because it's your body and your health. And if you're the family member, remember this too: your role is to support, not to overshadow. The greatest act of love is to step back and let your loved one be heard, even if you think you're making things easier. Because at the heart of it, respect is just as important as medicine. Without it, the relationship between doctor and patient becomes unbalanced. And when respect starts to fade, something else begins to creep in, and this time, it shows up in the very pills you're given. Ugly truth number 4 is one that many seniors live with every single day, often without realizing the hidden dangers behind it. Overmedication is far more common than most people think. I'll never forget an elderly gentleman who once reached into his bag and showed me a plastic pouch filled with pill bottles, 12 different medications that he was taking every single day. Some of those pills had been prescribed years ago, for issues that had long since improved. Some were to treat side effects caused by other pills. And the saddest part? Not once had any doctor stopped to look at the full picture and ask the simple question, do you still need all of these? This is something called polypharmacy. That's just the medical term for taking multiple medications at once. And while it may seem like more prescriptions mean more care, the reality is, the more pills you're on, the higher the chance that they'll clash with each other. One pill might make another less effective. Two might combine to create dangerous side effects. And in far too many cases, it's not even the illness that makes a senior weak or confused, it's the cocktail of medications they're swallowing every day. Now, here's the misconception. Many people assume that if a doctor prescribes it, then it must be perfectly safe and absolutely necessary. But remember, prescriptions are often added over years and years, by different doctors, in different hospitals, for different reasons. Rarely does anyone take the time to step back and look at the whole list. So what starts as good care can slowly turn into an overwhelming routine of unnecessary, even harmful medication. And here's where you can take back power. You don't have to simply accept every pill forever. You have the right to ask for something called a medication review, at least once a year. It's a simple request, but it can be life-changing. You ask your doctor or pharmacist to sit down with you, go through every single prescription, and check, do I still need this? Is there a safer alternative? Could we lower the dose? Sometimes, just removing one or two unnecessary pills can improve energy, reduce dizziness, and even prevent dangerous falls. Never forget, you are not being ungrateful or difficult by asking these questions. You are protecting your body, your clarity, and your independence. Overmedication isn't a sign of good care. True good care is when every single pill serves a real purpose in helping you live stronger, not weaker. And while overmedication is risky enough on its own, the last ugly truth might just surprise you the most. Because this time, it isn't about the pills, the appointments, or even the conversations. It's about what doctors sometimes quietly believe about seniors deep down. Many of them quietly admit that they don't always believe seniors will follow their advice. Think about that for a moment. A doctor tells you to exercise more, or to change your diet, or to cut back on certain habits, but in the back of their mind, they may already be assuming that you won't do it. They may believe that at your age, you're too set in your ways, too tired to try, or too unwilling to change. And when that belief creeps in, it changes the way they talk to you. Instead of offering detailed guidance, they may give you vague instructions. Instead of encouraging you with patience, they might rush through, assuming it's not worth their energy. But here's the thing. And this is where the ugly truth falls apart. Many seniors do want to make changes. Many of you are willing to adjust, to try new things, to push yourselves toward better health. The problem isn't willingness. The problem is that the advice you're given often isn't tailored to your age, your body, or your lifestyle. For example, a doctor might tell you to exercise more. But what does that mean for a 75-year-old with arthritis in their knees? Or they might say, eat healthier. But how do you do that when your appetite is smaller, or your budget is tighter? Without clear, realistic steps, even the most motivated senior can feel stuck, unsure where to begin. This is why you have to turn the conversation back in your favor. Don't just accept general advice. Ask your doctor for small, realistic steps that fit your life. Instead of saying, I'll try to exercise, ask, Doctor, what's one simple movement I can do at home every day without hurting myself? Instead of nodding when they say, eat better, ask, can you give me 2 foods I should add to my diet this week that will actually make a difference? By narrowing it down, you take advice that feels overwhelming and turn it into something you can actually act on. Because here's the truth, change is possible at any age. Doctors may doubt it, but you don't have to prove them wrong with big dramatic gestures. All it takes is small, steady steps that show you still care about your health, your body, and your future. Now that we've uncovered these 5 hidden truths, it's time to pause and face what all of this really means, not just for your health, but for your heart. It's painful, isn't it, to realize that age alone can sometimes make you feel invisible, even in a doctor's office. The place where you should feel most safe, most cared for, most respected, can suddenly feel like the very place where your voice gets lost. You walk in with hope, but you leave with doubts. And that kind of experience can weigh heavy, not just on your body, but on your heart. But here's what I want you to hold on to: these ugly truths are not here to scare you. They're here to empower you. Knowing what really happens behind the curtain gives you an advantage that most people never use. Instead of sitting quietly, you can step forward with confidence. Instead of letting fear shrink your voice, you can strengthen it. Because when you understand the patterns, the rushing, the dismissing, the assumptions, you can stop them in their tracks. Think about it this way. Every time you speak up, every time you insist on being heard, you aren't just protecting your health. You are reminding everyone in that room, doctor, nurse, family, that your life and your choices still matter. And that's powerful. That's not weakness. That's wisdom. So here's what I encourage you to do: if you ever notice a doctor rushing you, dismissing your concerns, piling on unnecessary prescriptions, or speaking to your family instead of you, don't let it slide. Speak up. Ask for clarity. Ask for reasons. Ask for alternatives. Your voice matters, and sometimes it's the only thing standing between being overlooked and being truly cared for. And I want you to remember this too: the truth may feel heavy right now, but awareness is the very first step toward dignity, respect, and better care. You are not powerless. You are not just a number on a chart. You are a whole person, with years of wisdom, strength, and resilience. And that deserves to be honored in every appointment, every conversation, every single decision about your health. So take a deep breath and let this sink in. You don't need to fear these truths. You can use them. You can carry them like a shield. And with them, you can walk into your next appointment not with dread, but with confidence, knowing you're prepared to ask the right questions, to stand your ground, and to be truly seen. Let's take a moment to look back at what we uncovered today. We pulled the curtain back on 5 ugly truths that many seniors face but rarely get told outright. We saw how doctors sometimes dismiss real symptoms as just aging. We talked about how many older patients get less time in the doctor's office, even though they often need more. We uncovered the hurtful reality that doctors sometimes speak to family members instead of you directly, leaving you feeling invisible. We exposed the hidden dangers of overmedication, where more pills don't always mean better care. And finally, we faced the quiet belief some doctors carry, that seniors won't follow advice, even when the will to change is very much there. Now, I want to hear from you. Which of these truths have you personally experienced? Was it a rushed appointment? A prescription list that felt endless? Or maybe that moment when you sat in the room and realized the doctor was talking around you instead of to you? Share your story in the comments below. Your experiences don't just matter to me, they matter to everyone in this community. You never know who might read your words and realize they're not alone. And if this conversation opened your eyes, if it made you think differently about the way you approach your health, I invite you to subscribe to Elderly Wisdom Tips. This is a place for honest, empowering discussions about aging, health, and dignity. Let me leave you with this. Stay informed, because knowledge is power. Stay strong, because your voice deserves to be heard. And most of all, always remember, your wisdom is your power. It's what sets you apart, it's what guides your loved ones, and it's what gives you the strength to demand the care and respect you deserve. Thank you so much for watching. Take care of yourself, and I'll see you in the next video.